All right, everyone, I'm going to go ahead and introduce our next speaker. So if you can, please take your seats. So our next speaker is Dr. Elizabeth Pinsky. She is a child and adolescent psychiatrist and pediatrician at Massachusetts General Hospital, where she is the Associate Director of Pediatric Psychiatry Consultation Service and at Shriners Hospitals for Children in Boston. Her clinical interest or clinical focus is on the intersection of child mental and physical health. Dr. Pinsky believes that climate change poses the most urgent threat to children at the intersection of physical and mental health, and that clinicians caring for children have a responsibility to advocate for a rapid and just transition off fossil fuels. She serves as the Associate Director for Advocacy at the MGH Center for Environmental and Health, and is also the founding member of Climate Code Blue, a Boston area climate action group for physicians and other health professionals. So please help me in welcoming Dr. Pinsky.
So it's terrific to virtually be with all of you today. I wish I could be with you there in Idaho. I am going to be talking to you today about climate change and mental health. And if I understand correctly, Walker and Ethan, I'm going to try to aim to be closer to like half an hour so that we have some time for discussion. And I don't know if we have the ability to be interactive or if you guys have the ability to throw things in the chat or ask questions as we go, but I'm super happy to do things that way as well. So I have no disclosures other than that these are my two little climate activists and my own personal motivation for doing this work. We tend as physicians and as clinicians to talk about things like, oh, here's what we observe and here's what we see and this is what the children are experiencing and what young people tell us. And I just want to acknowledge that probably I'm not the only person online or in the room who's experiencing some climate anxiety and anxiety about what the future holds in terms of climate. And so do like to take a minute sort of at the beginning of these talks to center ourselves in that and acknowledge that we're not just talking about what other people are experiencing or what's happening to our patients, but really we're all in the same boat with this stuff. So I'm going to try to give just a brief overview and, as I said, leave some room for conversation, touching on four main points. We're going to talk first about the fact that climate change harms mental health and that it does it directly through pathways like heat and air pollution. We're going to talk second about how climate change harms mental health indirectly through traumatic pathways, chronic, acute, and vicarious exposure to climate-related trauma. We're going to talk a little bit about young people and why they're at greatest risk. I actually think you guys are not getting a pediatrics lecture today, so maybe I'll touch on some of the physical health harms to children as well. But that while children are at greater risk than adults for the mental health harms of climate change, they are not all at risk equally. And finally, we're going to talk a little bit about eco-anxiety, this concept that gets thrown around a fair amount in the popular press and out in the world, and the fact that it is not a form of mental illness, but that it still matters and is still something that we should pay attention to. So starting from the top, climate change harms mental health directly through the twin harms of increasing heat and of air pollution from the fossil fuels that we're burning. And just a big picture overview, heat makes us feel lousy. It impacts our ability to learn. It impacts our ability to sleep. It makes it hard to think. It makes us cranky. And there's data to show that it makes us actually violent and aggressive. For people who have actual mental illness, heat also increases symptom severity and leads to worse mental health outcomes. It's also really important as clinicians, and for those in the room who are mental health clinicians, for us to remember that our patients with chronic mental illness or severe mental illness are at extraordinarily high risk from heat and heat-related illness. So diving in just a little bit further and starting with those general mental health or well-being impacts of heat, whether or not you have mental illness, heat is impacting your ability to think and to learn. It does that acutely. So during heat waves, students who have air conditioning in their housing perform better on tests than their peers who've slept the night before in hot housing. So it does it acutely. There also are big studies that show that heat impairs learning over time. So if you look at standardized test scores in really big groups of high school students, learning is actually lower during school years where the weather is really hot, and that risk is almost entirely eliminated for students who have air conditioning. So the heat itself impacts your learning, not just in the moment, but also over the course of a school year. There's also emerging data that shows that exposure to extreme heat in utero can impact longer-term cognitive impacts for young children. I couldn't find an example in Idaho, but this is from, your next state over in Salem, Oregon. I know that here in New England as well, school buildings were not built to withstand heat. They were built to stay warm in the winter. And so the likelihood that a school building or a classroom has cooling, and that the school year is timed to make the building cool enough for learning, is really up in the air, and is not necessarily true in all cities or in all communities. That same paper that looked at the really, really big group of high school students and their learning over time showed that how likely you are to have cooling in a given school building is impacted by how many Black, Hispanic, and low-income students attend a given school. The EPA has estimated that you can actually calculate the learning loss associated with degrees of warming, and that according to 2-degree or 4-degree warming scenario, we can expect learning loss of 4 to 7%. If we know that that learning loss is eliminated if your school building has air conditioning, then knowing how inequitable the distribution of cooling is in school buildings becomes really, really important. Because we're not giving all kids the same opportunity to stay cool and to learn. So heat impacts learning. Again, continuing to talk about just general impacts on well-being and not necessarily diagnosable mental illness, we have data that shows that heat just makes us feel bad. This is a very large study from the CDC on subjective mental health, asking people, how do you feel like your mental health has been over the last month or so? And above a certain threshold for ambient temperature, around 30 degrees Celsius, about 85 degrees Fahrenheit, there's a measurable impact on people's subjective sense of well-being. And that's actually the greatest impact is on low-income people and on women. We feel lousy when it's hot out. Unfortunately, it turns out that heat doesn't just make us feel badly, heat also makes us behave badly. So this is a recent study looking at geolocated tweets, really big data set, about 40 billion geolocated tweets from the USA, showing that both in hot and cold temperatures, but more so in hot temperatures, there's an increase in the amount of hate speech, in this case, hate tweets online, both as a raw number and as a proportion of total tweets. So heat just makes us obnoxious and aggressive. There's also data showing, unfortunately, that this is not just the things we say or the way that we feel. This is a big study from South Korea looking at assault deaths correlated with temperature data, showing a 1.4% increase in assault deaths per 1 degree increase in ambient temperature. And this is over, I think, 10 years in Seoul. It flattens out at a certain point at a relatively high temperature in the summer, and the increase is highest in young people, and specifically in young males who have lower educational attainment, who are more likely to have this association. Okay, moving on to think about people who have mental illness and sort of what are the outcomes there. There's decades of data to show that the symptom severity and outcomes for people with mental illness are also worse when it's hot out. So these are studies of violent suicide, of mania, PTSD presentations, crisis presentations in the ER. And then this more recent study looking at utilization, at how likely people are to present to the emergency room with a psychiatric diagnosis. And again, higher ambient temperatures associated with an increased risk of coming to the ED for a range of mental health conditions. I know that this graph is too small for you all to read, but it's true not just for overall mental health presentations, but also for a wide range of specific mental health disorders, substance use disorders, anxiety, mood disorders, schizophrenia. The one exception, interestingly, and we could sort of think about why this might be, in the lower right-hand corner, that one diagnosis that has sort of more of a U-shaped curve, that's adult personality disorders. So that one down there, that seemed to follow a somewhat different pattern in terms of how likely people are to present to the emergency department with that diagnosis when it's really hot out. Okay. I did want to touch too, sort of conversely, not only does heat make mental illness worse, but people with mental illness are extraordinarily vulnerable to heat. I wanted to touch on the data around people with chronic mental illness, severe mental illness. So these are data from the Northeast Heat Dome in 2021, looking at excess mortality based on chronic illnesses. And you can see that there's sort of some physical illnesses that it would make sense to us. That's chronic kidney disease and below it ischemic stroke, with elevated odds ratios of death during the extreme heat wave. But that one on top, all the way over there, odds ratio of 3 for people with schizophrenia, really, really, really high risk for death in a heat wave for people with chronic mental illness. And sort of the reasons why is a whole other talk. There's based on thermoregulatory issues in people who have schizophrenia and probably also some mood disorder. The medications that we prescribe to people with chronic mental illness further impair their ability to thermoregulate. And then there are all kinds of environmental and behavioral factors that push these patients at risk. But as we as public health professionals think about what we need to be doing to protect our communities and our neighbors in extreme heat, specifically thinking about people with mental illness is really important. I've talked a lot about heat and the impact of heat on mental illness. Air pollution is also linked to a wide range of negative mental health outcomes. So people who live in areas of the world or in cities with poor air quality are more likely to have a range of diagnoses: anxiety, depression, schizophrenia. Children have lower IQ, more likely to have attentional problems. But interestingly, acutely, episodically, poor air quality is also linked to crisis presentations, both for children and also for adults. It actually seems like wildfire smoke specifically, which I know is an issue out where you guys are, may be especially toxic in terms of acute mental health effects and likelihood of people presenting to the ER for a crisis, a mental health crisis evaluation. Okay, so that was a whirlwind tour through the mental health impacts of climate change that are direct through increasing heat, increasing ambient temperatures, and then air pollution. I'm going to turn now to the mental health harms associated with exposure to climate-related trauma. So what do I mean by that? We know from the disaster literature, there's quite a robust literature, that exposure to the types of acute traumas that are becoming more common, more severe, and less predictable as the planet warms, things like hurricanes, floods, wildfires, extreme heat, that those are associated with a wide range of negative mental health outcomes. So PTSD, I think, makes good sense to most of us, that if you are experience a hurricane, your house is destroyed, there may have been injuries or even fatalities around you, that your risk of PTSD would go up. There are also, however, increased rates of anxiety, depression, substance use disorders, community violence, including interpersonal violence, child abuse, and also suicide, all go up in the wake of extreme weather event. And there's data from hurricanes Katrina, Sandy, Harvey, from British floods, also first responders, specifically to wildfires. A lot of this has been demonstrated. This is just one study that's particularly powerful because it's been very long term, looking at survivors of Hurricane Katrina, who this study was started in New Orleans actually prior to the hurricane, looking at sort of a different set of outcomes. So they had both pre and post data for these people, specifically parents. They've continued to do follow-ups, and the most recent ones I've looked at are at year 12. There still are increased rates of post-traumatic stress symptoms and also just non-specific psychological distress for people who lived through the hurricane compared to people who were not in New Orleans at the time. There then are what I think of as slow-moving catastrophes. These slower, more chronic exposures to climate-related traumas, things like drought, famine, loss of land to rising seas or encroaching deserts. And these are the kinds of longer term cascading or chronic traumas that are associated with the kinds of PTSD that I see frequently in the emergency department, where people have had long term and recurrent traumas. These are a little bit harder to study than acute traumas because you can't just sort of helicopter in, do your study, and get out. But there are data to show that these chronic exposures are associated with all kinds of social determinants of health and existential distress, grief, loss of identity, and also suicide, specifically in farming communities. There finally is this kind of mushy exposure category, what I call vicarious exposure to climate-related trauma. And this is what sometimes gets called eco-anxiety or climate anxiety, just awareness of what's happening, of the inadequacy of the response, and of what people are predicting for the future makes people feel dread, despair, grief, rage. Solastalgia is a term that people may or may not have heard. Solastalgia is a term that is used to describe the experience of being homesick when you are at home, but home has changed around you. The example I hear frequently is in the Midwest, people who used to have skating rinks in their backyards every winter who can no longer do so. That experience of just my home is not my home anymore because it has changed around me. And I've been giving this talk, versions of this talk, for many years. I added this little orange arrow here. When I went to give this talk in Vermont, I think probably like 3 years ago now. And that was because I was going to give the talk in Vermont. I had been invited, 6 months prior. And during that 6 months, there were floods in Vermont, like hadn't been seen ever before. And there were deaths, a lot of destruction, and there were several deaths in the state. And it was a bit of a wake-up call for me. I had oftentimes thought of these categories of people who are at risk of exposure to a hurricane, people who are at risk of, famine and drought and civil unrest, and then people who just kind of need to worry about climate change but can just feel anxious about it as being different categories. And Vermont had always been thought of as like this climate safe haven, and there was fresh water, and it was cool. It wasn't going to get too hot, and it was a realization that really all of us are likely to fall into all of these categories at some point in our lifetimes, and that even in Vermont, no one anymore is able to sort of say, I am only at risk of vicarious exposure to climate-related trauma, and I'm not going to experience this directly. We're all going to experience this directly. Thinking about that solastalgia and also that existential distress associated with chronic exposure to climate-related trauma. I am not Indigenous, but try to be aware that I cannot imagine what type of risk would be associated with the loss of land for people for whom identity is so tied to the land. This is a movie that features folks from the Labrador Inuit communities talking about what the experience has been of losing sea ice when you in fact identify as a person of the ice, that who is who you are. So it's available online, and that's the URL there. Okay. 18 minutes. All right, we're doing good. I'm going to move on to point 3, which is that youth, children, adolescents, and young adults are at greatest risk of all of those mental health harms related to climate change. But then importantly, that risk is not distributed equally, and not all youth are at equal levels of risk. I did say earlier that I don't think you guys are getting a pediatric centered talk today. The fact of the matter is that kids are more vulnerable than adults to all of the health harms of climate change. So if we look at all the different ways that extreme heat and severe weather and air and water pollution and land loss are contributing to health impacts, pretty much all of these are experienced either more frequently, more severely, or with worse outcomes by children. So, the WHO estimates that 80%, maybe it's 85% of the burden of climate change is borne by children 5 and under. Climate change is increasing all of the top 5 causes of mortality for infants. Climate change really is a child health emergency. And why is that? It's for a variety of different reasons. And I recommend this paper by Pereira and Nadeau from the New England Journal a couple years ago that really specifically looks at the disproportionate vulnerability for children. But there are factors that increase kids' exposures to climate-related harms. There are factors just in terms of their developing and growing bodies that make kids biologically more susceptible to the threats of climate change. And then kids have reduced adaptive capacity. They are less able to protect themselves from the harms of climate change because they're reliant on adult caregivers, and because of those critical periods of development where they're particularly vulnerable and not as physiologically resilient. So thinking about that specifically, kids need proportionally more food and water for size, so they're more vulnerable to malnutrition. And we know that malnutrition impacts their veins for their entire lives if they experience it in infancy. Vector-borne diseases, in terms of exposure pathways. Here in New England, the range of Lyme disease is expanding, and the incidence is highest in school-age boys because they're the ones who are out in the woods rolling around and getting ticks on them. So, the burden of asthma and allergies is highest in kids. In all of these different ways, kids are the most vulnerable to the health effects of climate change. And that's true for mental health impacts as well. So why is that? Some of it is the immature physiology that makes kids more vulnerable in other ways as well. Their brains are developing, and toxins or other impacts impact them neuropsychiatrically more while they're developing. They're dependent on social systems and adult caregivers and on the things that are disrupted during climate-related disasters. So schools being the big one. Kids really exist within systems. They need adults, and they need adult systems of care. Those traumas and those traumatic pathways that we talked about, we know have vastly oversized impact when they're experienced in childhood. So this is the adverse childhood experiences data. So both psychologically, but also in terms of physical health, trauma experienced in childhood has way outsized impact over the lifespan. Then it's just temporality, right? So kids are going to be alive for more of the climate crisis. And as the climate crisis deepens, they will have more opportunities to experience cascading climate-related traumas. And then there's this psychological vulnerability that we'll talk about if we have time a little bit later. But there is something unique about how children developmentally, in terms of their psychological development, appropriately expect adults and adult systems in their lives to care for them. And I do think that the inadequate response by adults and by governments to the climate crisis inflicts a sort of unique type of psychological harm on children who rightfully believe that they have the right to be protected by the adults in their lives. It is really essential to acknowledge that while all children overall are more vulnerable than adults because of racism and other systemic inequities, not all children are equally vulnerable. So how likely you are to experience a psychological trauma during an extreme weather event depends on your infrastructure and how close you are to a amplifying hazard, electrical infrastructure, chemical infrastructure, the quality of your housing to begin with. Black and brown communities already have lower access to mental health care and mental health infrastructure that's more likely to be damaged in the case of an extreme weather event. Black and brown neighborhoods are hotter, physically hotter because of reduced tree cover and other factors. And green space, which is increasingly thought of as a response or as an intervention for climate-related distress, is less available to certain communities. This is really important to acknowledge, but I do like to turn it on its head a little bit because there's lots and lots of things that we talk about in medicine where people who are more disadvantaged or communities that are minoritized are at greater risk, almost, all of the social insurance that we talk about. But unlike some of those threats or harms, climate change is fundamentally it is a crisis of injustice. The crisis of climate change is that the people who have burned the most fossil fuels and contributed most to the crisis, older people, people in the global north, talking just about here in the US, people with greater amounts of wealth, they're the people least likely to experience harm. So it's not just that systemic injustices, including racism and other things, make climate change worse. Racism is actually like the necessary precondition for us to have the system that led to climate change. So I do think it's a little bit different and important to think about it a little bit differently. And this is an excellent essay by Hop Hopkins that makes this point better than I could if people are interested. Okay, that is going to bring us to our final point here, eco-anxiety, which when I say I go around and I give lectures and I talk and I think about climate change and mental health, this is what everybody thinks I'm talking about, even though it's the fourth and in some ways the least important point. Eco-anxiety is not a form of mental illness, but managing it still matters. So I can't see the room or online, but I'm going to let the room take a look at this cartoon for a second. And everybody can think. Does the young koala have a mental health problem? I kind of think he might, right? He's probably experienced very significant trauma. He looks kind of traumatized, so he may have a diagnosable mental health condition. But so why is the cartoon funny, and what is the issue with the cartoon? So there's the obvious thing, which is that we are pathologizing a very normal response from the koala. And anxiety about climate change is super healthy and adaptive in my mind. It's a sign of health, a sign that you're not in denial, sign that you are connected to the world and the people and the animals that live in the world. And so to me, anxiety in this case is adaptive. It is allowing us to acknowledge and prepare for a threat. But the bigger problem to me than pathologizing the koala is that this cartoon ignores something really important. The most important thing here is what is missing, which is who cut down the eucalyptus trees, right? The answer is the fossil fuel industry. The fossil fuel industry cut down the eucalyptus trees. But in talking about or focusing on the koala's anxiety, the koala's eco-anxiety or experience or whatever it is, we're individualizing a problem that really is a systemic problem. And you'll see this next time you see an article about eco-anxiety, it almost certainly will say nothing about sort of the fossil fuel industry or the conditions that have led to young people having so much distress about their futures. And that I think is actually the larger problem with thinking of this koala as having a mental health problem, not that we're pathologizing him, but that we're individualizing what is happening for the koala. So that said, should we all just be climate anxious and should we not care the people? No, climate anxiety is actually important. And as it turns out, it is quite widespread. Thinking back to that slide where I listed those 3 categories of exposure to climate-related traumas, prior to this survey in 2021, there was a sense that in the places in the world where people are most impacted by climate change, they might have climate-related trauma, they might, but that they weren't really worried about climate change, that eco-anxiety or climate grief was not such a thing. And most of the data that we had on anxiety or distress about climate change was from the global north, it was from the US and the UK and Australia. This survey looked at young people in 10 countries, 10,000 young people in 10 countries around the world, in the global north and in the global south. And what they found is that young people are really quite distressed about climate change everywhere in the world. It depends a lot how you ask the question. So again, this is 2021, and this is young people's feelings about climate change. And then these are their thoughts about climate change. That 41%, I'm hesitant to have children, got a lot of attention when this survey came out, but it's actually been replicated lots of places. Climate change really is impacting young people's reproductive decisions, hesitancy to have children. This 45% feelings about climate change affect my daily life and functioning, that unsurprisingly is actually quite higher in countries in the world that have been more impacted by climate change. So of the 10 countries, India, Philippines, Nigeria, the rates where there was impact on daily functioning were actually quite a bit higher. So young people really are feeling quite climate anxious around the world. Some of the same authors were did a similar survey here in the US last year that essentially shows that young people are really worried here too, irrespective of political party, irrespective of geography, although those things do impact the degree of concern that people have. There's a URL down on the bottom there and also here where you can explore actually state by state what types of climate exposures young people have had, what kinds of disasters, and how they feel about it. And unsurprisingly, the degree of distress that people have and also their plan to take action on climate increases proportional to their exposure to severe weather events, and that's irrespective of political party. So why should we care about this worry about climate change? This is from the work of Leslie Davenport, who sort of is the grande dame of climate anxiety and climate distress. And it's because if you are either in denial or trying not to think about climate, or if you are so anxious and so distressed and you're standing in the supermarket and you don't even know what to buy because there's so much plastic and you can't go on with your life, you're not able to do the things that we actually need to do to tackle the climate crisis, what Davenport calls the window of tolerance with optimal functioning. And so the goal of thinking about climate anxiety and helping people with it is to get them into that window where they're neither hyper-aroused nor hypo-aroused, and can actually help tackle the climate crisis. How common is climate anxiety? Again, if you can't measure it, you can't mitigate it. And there have been a variety of measures that have been developed. This one is from Clayton in 2020. Their initial surveys showed that about 17 to 25% of people in the US at least sometimes had functional impairment or really significant emotional distress related to the climate crisis. This most matters because what we want to know is, is being distressed about climate change good for climate action, or is it bad for climate action? This study from last year in 2024 showed that the more distressed you are about climate change, actually, the more likely you are to take action, and that there was no sort of ceiling there. So it's not like being too distressed about climate change paralyzed people and made them not take action, but that you do need some dose of climate anxiety in order to take climate action and do the things that we need to do to mitigate the crisis. There also are some really interesting data looking at the relationship between climate distress and clinical anxiety or depression. And it's not clear what the relationship is or if there is a relationship, but these data from here in Boston looking at college students showed that for young people who do have both impairing climate anxiety and symptoms of depression, specifically collective action, so doing things in a group with other people, can help attenuate that relationship. So basically, being a climate activist, but specifically doing it with a group, can be protective for anxiety and depression associated with climate. Okay, so we're almost there, friends. How do we support the young people in our lives? And also the adults in our lives, if there's anybody in the room with climate distress. There's some common sense things, monitoring dose and sources of media. I like to remind people that doom scrolling is not actually a form of climate action. So being careful about staying informed, but not getting yourself so informed that that it just becomes avoidant coping as opposed to actually dealing with things. And then some of the most important ones, finding an effective group for advocacy and activism, and that Schwartz study shows us we actually have data to support that now, but really finding a group that you can be doing action with, encouraging young people and specifically to take collective action, and there's lots of opportunities for that out there. And then I talk to young people who come in who do have climate distress quite a bit about focusing on systems and the fact that individual action matters, collective action matters, but it is fundamentally the systems that we all live in that are impairing our ability to make progress on climate, and focusing too much on your own footprint or on the things that you're doing at the expense of seeing the bigger picture and attacking sort of the systems, I think can can be a source of shame and can make getting active on climate more difficult. So I actually do like education with young people about the fossil fuel industry. And I find that that is sometimes helpful in terms of relieving climate distress. Okay, so I think I have done my job and left some time for discussion. We have covered our 4 take-home points. Climate change harms mental health through heat and air pollution. Climate change causes climate-related traumas that are other pathways to climate and mental health. Young people at greatest risk, though not all equally. And eco-anxiety is not a mental illness. People with eco-anxiety aren't crazy, but managing it and paying attention to it matters. All right, so that is what I have. I am happy to share resources. And somebody there has to tell me how we can go about having conversation with the folks in the room if we have time.
Hi, I'm Katie O'Neill. I'm with the city of Boise. So when you talk to people, young people especially, about like, oh, it's not individual or collective actions, it's the systems, what do you suggest they actually do about that? To me, I feel like that could almost be disempowering if you say like, oh, well, it's the systems, you know, like what can we do about that?
I mean, well, you were the city of Boise, so I don't know what Boise needs. I don't know what Boise needs to act on in this particular area.
I'm speaking as a personal, the city's doing a lot of really good climate work. So for me personally.
The city's knocking it out of the park is what I've heard. You know, it's funny. I don't find that that actually is disempowering for young people. Because I think often what young people want to do is they do want to take on the system, right? And take on injustice and sort of the adults or the adults of the adults, which is the government, that they see as causing problems. So what I think can be disempowering or a little bit of a distraction is when people feel like, oh God, but I'm not even recycling, or I still have an internal combustion engine and I've got to get an EV and we don't have the solar panel. And I feel like, well, climate activism is definitely a two-edged sword in that self-care isn't great among youth climate activists, and people need to, know they can take breaks, and people need adult support and all of that. I think that as a group, it's the youth climate activists who really were most successful at activating the rest of us and the rest of the population around climate issues with, Fridays for the Future and sort of the youth climate strikes and stuff. So I'm sure that that is true for some young people, and it's certainly not going to be like, one size fits all in terms of what type of climate action is useful. But I think that that actually hasn't been my experience, that thinking about larger systems and larger forms of injustice is disempowering for young people, because I think that actually, in many cases, these have shown us that they're interested in rising to that challenge. It doesn't have to be the whole system. It doesn't have to be like the CEO of Exxon, but losing sleep over your own carbon footprint at the expense of political and collective action is, I think, a little bit more what I'm talking about. I don't know if that answers the question.
Thanks. That was a really wonderful talk. I'm Katie Conlon. I'm an epidemiologist who studies climate impacts. And earlier we had a comment from one of the speakers about greenwashing. So I personally have gone through every stage of grief as it relates to climate change, just in my occupational hazard.
Me too.
Yeah, same. And I find myself going through that cycle again when I see greenwashing happening, and it happens, I feel like it's everywhere, right? Everybody's talking about sustainability, but sustainability means different things to different people, right? And different organizations. I'm curious if there is any research in that space around the impacts that greenwashing is having on mental health, especially amongst youth, because I imagine that might be a population that is going to be experiencing greenwashing for a lot of their life. How might they be responding to that phenomena?
I don't know. I think if anyone, there's greenwashing, there's then also misinformation, which is also, I think, just in the sort of toxic stew of all of us flailing around trying to figure out how to be most effective and where to put our energies, but you don't even know who are the good guys and who are the bad guys because everything's so mucky. The folks at the Yale Center for Climate Change Communication, I think they may be thinking about this and may be doing some kind of work on it. I don't know of anything specifically looking at the mental health effects of greenwashing. I do know that young people have excellent, trying to think of what term, they have bullhooey detectors that are finely honed far more than adults. So I actually wonder if obviously there are ways in which social media and sort of the sources of information that young people use make them more vulnerable to misinformation and to greenwashing, and also who they are just as people. That's why I love adolescents. They're very good at telling when they're being fooled by people in power, or when people in power are trying to fool them. I don't know. I will say, I guess, that it also a little bit harkens back to the previous question about systemic action. Systemic action could be as simple as calling your CEO or a company in town or a school district or somebody in power on their greenwashing and rejecting it.
Steve Smith, pediatrician, thank you so much. Curious, you'd mentioned that there was a connection between air pollution and mental health in urban areas, and I was just wondering, with so many other variables that can affect mental health in an urban area, do you happen to know how the research isolates air pollution?
I mean, it depends on the study. There's studies looking at all kinds of different mental health impacts. I would agree, the acute air quality data is different from like the neurodevelopmental or the epidemiologic data. So it varies. It's a pretty large literature at this point, or at least a relatively large literature, if we include in mental health neurodevelopmental outcomes and neuropsychiatric outcomes as well, IQ, autism, stuff like that. But it varies by study, whether it's the size of the sample or something else that allows them to control for the confounders. But yeah, there's a million confounders. It's the same thing with the heat data, right? Like, we say these things are more common when it's hot out, but when it's hot out, it's also summer. People aren't in school and they're hanging out in their cars and drinking beers and doing all kinds of things they shouldn't be doing. So all of these things are hard to study. And there's a variety of different ways that people have tried to crack the nut.